Kelly. I'm from Fort Myers, Florida. I'm a medical assistant for an orthopedic surgeon. And this is my iFuse story. When I first started experiencing SI joint pain, and I was probably about 17 or 18, coming home from high school, I would try to take a nap and my back would just hurt from walking around all day. And trying to lay down was the hardest thing to do after a long day, and it should be the most relaxing, but it wasn't. I had 2 MRIs, and all of them came back completely negative, so I just kind of lived with it for a little bit. Saw a couple surgeons. Eventually got into one doctor who gave me an injection in my SI joint and helped my pain dramatically. But it only lasted about 2 weeks, which was okay. I finally knew what the answer was, so I was on the hunt to try to figure it out how to fix it. You know, it was diagnosed, but I couldn't figure out how to fix it. There's not a lot of doctors in the Fort Myers area that touch SIs in general, so I found the closest person. He was in Miami, drove all the way to Miami. On the way to Miami, I realized sitting in a car was probably the worst thing I can do. For a 2-hour car ride, it was miserable. So, get to Miami, he does the injection. I tell him, hey, I want to go ahead and do the surgery. You know, I'm 23, I don't want to live with SI joint pain for all my life. And he told me no, I was too young. I work for an orthopedic surgeon, and he just hired another orthopedic surgeon who relocated from out of state, and he was trained in the SI joint fusion.
I'm Dr. Peter Ameglio. I'm an orthopedic surgeon. I live in Fort Myers and I take care of all of Southwest Florida. When Kelly came to me, I was struck mostly by the fact that she was young and so debilitated by it. And because she works in her office, she couldn't reach down and pick up an object or a pen. If she dropped the pen, she'd have to ask someone else to do that. And then she, of course, recounts how it affects her social life.
Because my pain started in high school, that's the time we're supposed to be going out, having fun, dancing. I couldn't stay out late. By 10:30, 11 o'clock, I was ready to go home. I couldn't stand up. I couldn't dance all night long. I was tired. My back hurt. I needed to sit down. And then once I sat down too long, I needed to stand up. And by then, I'm just ready to go home. So I was kind of the party pooper in high school.
With Kelly, it was primarily the quality of life. Kelly might be in her early 20s, but yet she was living a life of somebody much older. And that was not acceptable for her.
A lot of people told me not to get the surgery because I was just so young. You know, that's something older people do when their back hurts. I didn't want to wait till I was old to have back pain. You know, I had back pain now. Why be miserable for 60 years and then get it fixed? I might as well just get it fixed now and I can enjoy my life. I'm not going home in tears every day because my back hurts from walking around.
It takes me approximately an hour to do the iFuse procedure. And it can be done either as an inpatient or outpatient, tailored to the patient's needs.
The incision for the iFuse is about this big, and it's right where like your bikini bottom goes, and so I can wear a bathing suit and you don't even see it. It's right on the line of the bathing suit.
The most remarkable thing was in the recovery room. For one thing, she was smiling, and she said, "Doc, it hurts, but it hurts so good," which I thought was funny. Of course, it recalls the song "Hurts So Good." So,
my life now, there's no problem sleeping, driving for long periods. I can stay up as late as I want, stand as much as I want. I stand probably 10 hours a day at work. No back pain at the end of the day. And you know, I see people go home and they're like, that was a long day, my back hurts, and mine doesn't.
If you think that you may be suffering from SI joint dysfunction or hip pain, and you've seen other physicians perhaps and are not clear as to what the source of your pain is, please visit my website or give me a call to schedule an appointment. I'd be happy to see you and help you sort it out.